I think that what President von der Leyen laid out actually is a very good expression of what's emerging best practice on how to move forward post first wave of this pandemic. Essentially, first you have to remember the different EU member states are in very, very different positions. You've got countries like Italy, Spain, France that are still struggling to come out of the first wave, to a large extent the UK as well. On the other hand, you have countries like Germany, Austria, to some extent Denmark, that have done a good job managing the crisis from the first, where there's been a clear and sustained downward trend, I would argue, in the number of new cases per day, and where the number of deaths has never gotten out of hand, and especially important, where the healthcare system hasn't been overloaded. Now, the European response that was published yesterday talks about having a differentiated response and recognizes that the different member states are in different places, but tries to set out a general sequence. And I think it does exactly the right things here. On the one hand, it's focusing on a gradual, step-by-step, cautious opening with the recognition that there could very well be flare-ups after the initial opening, and that the countries have to be ready to clamp some things back down if they find that this happens. But conditions have to be fulfilled. First, a downward trend. Second, there has to be enough surge capacity to handle any flare-ups that take place, and also to do that without sacrifice to all the existing people who have existing life-threatening conditions. Third, contact tracing has to be done, and it's got to be done in sensitive ways that recognize European needs for protection of consumer privacy in some kind of balanced way. So, again, it seems to me the principles that are there are the right ones, and it calls for a differentiated approach that will necessarily be different from country to country. I might add, it also calls for holding off on big public events. It calls for holding off on an opening of international travel. It calls for gradual liberalization of travel within Europe, but it recognizes that the level of infections has to be somewhat comparable between the countries before the travel can really be fully opened up. A high infection country having lots of travel to a low infection country will make no sense, and the low infection country won't accept it.
Are there other strategies that governments could be employing that could have been recommended yesterday? At one point, countries were toying with the ideas of maybe letting different age groups out, slowly introducing the people who could come back into the workforce. Do you think they've missed anything that countries could employ?
Well, the strategy does include a couple of words. I haven't read it in full detail, but it includes a bit about protecting high-risk groups. And I think almost everybody has looked at this, believes that people with pre-existing conditions and the elderly continue to need to be especially protected over this period. So I think that's already there. Also, when we talk about extensive testing, and you said it before, it was said before on the program, testing. The Germans, the Austrians have done huge amounts of testing. That's why they're in good shape. But one form of testing is testing for people who are currently sick. Another form is testing for people who have been sick and therefore are presumed to have an immunity. How good the immunity is, how long it lasts, still uncertainties on this. But those that are presumed to have immunity could indeed play a critical role in reopening those kinds of businesses that entail substantial contact with the public. So that can be done, and I think should be done.